loud and clear. You ready to go?
Yeah, I'm ready.
I'll turn it over to you.
Can y'all see that?
No, we're still on your camera.
All right.
Okay, yep, there we go.
Okay, are we good to go? Is it on the title screen?
Yep, good to go.
Okay, perfect. All right, so I'm Kyle Little. I'm the director of strength and conditioning at McNeese State. I'm excited to hop on here with y'all and kind of share, my thoughts on the shoulder. And kind of the way this came about was a few years ago. I was having some problems with my football team with some shoulder injuries. And I thought I had a good understanding of the shoulder and how we should train it. And then, I started diving deeper and started listening to people that were smarter than me, such as Eric Cressy, such as Dr. Andrea Ospina, and realized that I didn't know as much as I needed to know about the shoulder to give these guys what they need to be able to perform their tasks on the field. And so I just wanted to share how I dug into it, the information that I found from these guys and how I apply it to my athletes to help them. So first thing I'm gonna do, I'm gonna give you an overview. I got a lot of stuff that I'm trying to talk about because it's extremely complex. But the main thing is keeping the ball in the socket. And when we think about this, the hip's a ball and socket joint too, but it's different. The hip is made for stability. It's got a deeper socket, whereas the glenohumeral joint is like a golf ball on its tee. And so when we're keeping the ball in the socket, we've got to look at arthrokinematics, which is the smaller movement of that ball in the socket, rather than osteokinematics, which is your flexion, extension, horizontal abduction, all that stuff. So, I'll get into a little bit more detail about that. We'll go over some important anatomy. So, we'll go over points of the shoulder that are a separate structure on the body that affects how the shoulder moves. And then we'll kind of dive into achieving motion. That's kind of a term that gets thrown out there, but what does that mean? And how you can achieve it and how I go about achieving it. Training through full range of motion, that's another thing that's thrown out there all the time, what that means. And then building strength at both ends is a concept I really want to get out there. It's not my concept. Somebody smarter than me started talking about that. And then how I apply these principles in my program. So keeping the ball on its socket. So right now we're talking about the glenohumeral joint. Again, it's not the same as the hip joint. It's unstable compared to the hip joint, which is why it has such a big range of motion. And so, if you look at the diagram, you can see all the joints like that. It's much more than we think. We can't dumb this down. It's not just rotations. It's not more rows, anything like that. We've got to attack this more of a complex thought process. And then, is it about the ball? Is it about the socket? Or is it about both? Because the humerus is attached to the scapula, which is a itself. So, the rotator cuff, its job is to pull the ball on the socket, among some other things like external rotation, internal rotation. And then the scapula has to move the ball to make sure we keep the integrity of this glenohumeral joint. Pay attention to arthrokinematics more than osteokinematics. And what's the difference? We talked about it. When I talk about arthrokinematics, I'm talking about glide. Is the head of that humerus going to the front of that fossa, which is that depression that ball fits into. And that's not what we want. We want that ball to stay centered on that glenoid fossa. All right. Why is that important? We want to keep the integrity of that joint. The more movement I get, the more stress I put on that joint, the more stress I put on those anterior structures like the labrum, all these anterior ligaments. All right. And then when the cuff gets more fatigued because it's pull that ball into that socket, we're going to get a lot more glide. So I'll talk about it, but the coach's eye is extremely important here when we dive into exercises that incorporate the shoulder, from benching to rowing to more detailed exercises such as working external rotation or working protraction and upward rotation. So the shoulder is extremely complex. So we can't do something extremely simple as full range of motion chin-ups or, you know, full vertical presses. We've got to have, like I said, we got to have a little bit more complex here. It's also extremely claustrophobic. It's got 8 major nerves running through it, the brachial plexus. All right, it's got 7 muscular attachments to the scapula. It's got 6 major blood vessels. So there's a lot of stuff going on in your shoulder. There's 4 joints to it: the glenohumeral joint, the scapulothoracic joint, the AC joint. And those are the 3 joints I really want to talk. And then the sternoclavicular joint, where the clavicle or the collarbone attaches to the sternum. But those top 3 in red, those are the really the joints I want to focus on when we talk about shoulder health and how we're going to attack this shoulder. Other joints of importance, and it's really a long segment of joints, is your thoracic spine, your cervical spine, your lumbar spine, and we'll get into that. The reason is these downward rotators and how they attach to these spinal segments. All right, the scapulothoracic joint. The way it determines a lot of the arthrokinematics that happen at the actual glenohumeral joint. And so what I'm talking about here is how the scapula articulates around the rib cage. And that's going to be important, from protraction to retraction to upward rotation, downward rotation, posterior tilt. So the way that articulates is extremely important. And a lot of it is the way that your T-spine shaped when we're asking your scapula to move. All right, so it's got to be able to move freely on that rib cage. And especially when we get into upward rotation and how the T-spine, you know, we should have a flexed T-spine when we start to try to create that external or that upward rotation to try and give that a better surface to upward rotate. So in order to get overhead, my scapula has got to be able to protract, upwardly rotate, and posteriorly tilt to clear and keep that subacromial space, which is that space between the AC joint, space between the AC joint and the actual head of the humerus, right? If I'm not getting upward rotate and posterior tilt, which is the top of my scapula backwards, you know, I'm going to run the head of that humerus up into that subacromial space. That's what we're going to try to preserve, right, a lot of these movements. All right. Now, protraction upward. This is important. One, not just for overhead athletes. This is extremely important for overhead athletes, but it's also important because a lot of us, even though, you know, maybe an O-lineman is considered a overhead athlete, we're asking them to do movements that require scapula to protract and upwardly rotate. So as the glenohumeral GH flexes the scapula, all right, it must move forward and rotate up so that ball stays on that socket as it comes up, right? The serratus anterior has to turn on, which, if you look on the picture, is the muscles that attach to the ribs right here that pull that scapula forward and rotate up. And it's relatively weak and small to a lot of your downward rotators. So this is going to be important going forward on how we can maximally train that serratus anterior. It's not getting inhibited by its antagonist. So like I said, chronic or overactive downward rotators such as the lat, you know, rhomboid, and then the levator is another one, which is why we incorporated the cervical spine into this. That can also prevent that serratus from doing its job to its fullest ability. And then how do we know, right, whether or not my scapula is moving correctly? One, we've got to make sure that, is it at a deficiency already? So resting, it should be about a 35-degree upward rotation from the actual spine, right? And then as I'm fully abducted or flexed, it should move to approximately 55 degrees. Now, I get it. I have 100 people on my team that I need to work out. It's tough to evaluate everybody's scapula, but if you're asking your athlete to go and they feel tightness or they don't feel comfortable, that's a sign that we need to really look at things and see how that scapula is moving up. Because if I take my hand on those players and I physically rotate their scapula up, it starts to deviate that feeling that they're getting from that. And so that right there, know that I've got some work to do on that. Posterior tilt. Ben Kibler said, posterior tilt of the scapula is extremely important in preventing an increased shear stress on anterior stabilizing structures, the labrum, the glenohumerus. And so it's not just about upward rotation. I've got to get that scapula tilted back. Right here in the picture is that I can see that posterior tilt, this space, this subacromial space, gets this AC joint moving backwards slightly to room for my humerus to come overhead, right? And so the muscle that does that, the low trap, and that's what actually pulls, if you can see right here, LT stands for low trap. It pulls that scapula into a posterior tilt to help clear that space, right? But it's easy to compensate for. People, I see it all the time. People are on the ground doing Ys, and I used to cover this before I started diving deeper and started listening to people smarter than I am, is they started to compensate with T-spine. And so we asked them to do a Y, we asked them to tilt that scapula, we asked them to get their wrists up, and what do? They get a big chest, they start to extend it, it's overextended the T-spine, and putting that on. Just like moving forward, just like the serratus, I've got to make sure that my antagonist isn't hypertonic, which is the pec minor. And that's what we see a lot of the time. We got these people that people say are anteriorly rotated. Well, that's an anterior tilt of the scapula, hypertonic pec minor that, I need to release. And that's going to be important when we talk about working that low trap, making sure that we take advantage of that and make sure that, we ask issue if it is an issue of that pec minor. All right, this is what people call the shoulder. This is the actual golf ball on the tee. And that's the reason it's the most mobile joint, is because of the bony anatomy, right? But it's normal human shoulder. Now, I'm not dumb. We're not aliens. I'm not saying that you have an alien shoulder. But back in the day, so evolution happens over thousands of years, right? So it just became sedentary in our lifestyle 100 years. So we still have a hunter-gatherer shoulder where we used to climb trees. We used to reach into these big ranges of motion, all right? Do that anymore. So if you're not working on that and you're not stimulating those mechanoreceptors at that end range of motion, mechanoreceptors, and we lose range of motion. So just because it's a mobile joint doesn't mean it's as mobile as it should be. And I can't just think of stability. I have to think of putting in adequate range of motion that I need for my athlete's shoulder. And we'll talk about the difference in athletes and what we're talking about there. But, that plays into the osteokinematics we're chasing. We say we want to get to 180 degrees of flexion. I need a bench. I need to get to about 40 degrees of extension, all that stuff. And so how do I tell whether or not I have a shoulder? It depends on the joint when we talk about this. And a lot of this I get from Spina. And I encourage a lot of the people listening to look into FRC, the Functional Range Conditioning course. It really shed a lot of light on the subject. Internal rotation at the shoulder, that lets me know, do I have access to the shoulder that I need to? And can I internally rotate approximately 70 degrees? And the reason is that lets me know the capsule. Do I have enough space in my joint to even be able to move, right? To be able to hit these osteokinematics, to have enough space inside the capsule to be able to even do that, let alone whether I have a hypertonic lat that won't let me, flex or whatever it is. So I want to get into anatomy. I kind of want a little bit just because I got a lot more to share with you guys. And this is kind of the latissimus dorsi, your lat. It has attachments at the scapula. So it is a huge down rotator. It attaches to the humerus, attaches to the thoracic and lumbar spine. So it articulates all the way down to your lumbar spine, which is why the lumbar spine plays a significant importance in, what we're going to be doing. There's its actions, but the big actions I want to cover are scapular downward rotation, humeral extension, and lumbar extension. It is a huge core stabilizer. So I'm not saying the latissimus dorsi isn't important. It's extremely important. We just got, what I'm saying is make sure that I don't have an athlete that their lats turned on all the time. They can't have that enough to be able to work other muscles. So, you know, I'm working against this muscle that's strong and it covers a huge area of my body. It's a core stabilizer just because of how large the attachments are, right? It covers my whole back. It attaches to my scapula all the way down to my lumbar spine. So it's a major transferring force from the lower body to the upper body. So I've got to make sure that I have a strong lat on that, right? But the exercise that the lat's going to inhibit is overhead movements, reaching movements. That overhead movements could be categorized into. It's going to inhibit external rotation. It's going to inhibit spinal flexion to the other side. So the lat's ability to tone down is going to affect how we get to overhead movements. And if I don't get into overhead movement with a lat that down regulates, I'm going to get more glide because, you know, I'm not going to be able to clear that subacromial space. So I get more arthrokinematics here just because my lat's inability to down regulate here. Rhomboid is another downward rotator that I want to talk about. It attaches to the it attaches to the spine. It downward rotates as well. And then the levator scapula, you can see how it attaches to the actual the scapula from the spine here. So, you know, it's a downward rotator. If I'm in cervical extension, when I say that, if we're looking forward, the spine actually moves two ways at one time. If I'm looking forward, the bottom of my spine is flexing while the top C spine is extending if I have a forward head position. If I'm looking forward, the top of my cervical spine here, if I'm getting into extension, I'm toning up that levator scapula and I'm working against it. You know, scapular tilt, you know, again, the pec minor is to your anterior tilter, and your low trap is going to tilt that scapular posteriorly. To make sure we know what we're talking about, there's some pictures there. The rotator cuff, this is important. Obviously, it pulls the head of the humerus into the glenoid fossa, and so you know, making sure that we're doing a good job of identifying, working our rotator cuffs effectively. All right, the supraspinatus. This is the most torn rotator cuff here. It's responsible for initial induction, but it's also active all the way through. And so this is a big player. It's responsible for up to 50% of total torque during abduction, even the deltoid turning on. And it's a huge deceler of the arm. And so when we talk about training the supraspinatus, if I'm not training in an eccentric fashion at some point in my program, I'm missing the boat a little bit on this one. We've got to really teach that supraspinatus to absorb force. Coach Joey talked about it in terms of isometrics. Like I want to train this eccentrically, I want to train this isometrically, and teach it to absorb force here. The subscapularis on this, it's an internal rotator. It's below your scapula. And your shoulder, it controls anterior glide, but it's got a lot of things helping it. The pec is an internal rotator. The lat is helping it as an internal rotator. So this is not something that I focus too much. The infraspinatus, this is going to be your external rotator. We can see where it attaches to, but it's another important arm. And so again, I'm probably at some point in my program going to train this eccentrically and isometrically. And then the teres is another external rotator. Guys, if I'm covering this too fast and you have questions at the end, please feel free. I want to make sure that we get to some other things. Other glenohumeral stabilizers that I want to mention, the long head of the bicep and tricep. I never used to do arms. I was always a complex movement guy and didn't understand, we're getting, bicep activation and chin ups and pressing. I'm getting tricep activation, but they're actually glenohumeral stabilizers. So I've incorporated a little bit more arm work into my program. And so, because we can see the long head of the tricep attaches to the scapula and ulna, so it's an elbow extensor. It's also an humeral extensor. So, and how we train that, we train triceps overhead. Alan Bishop has put some great posts about French pressing. French press would be a great exercise for this. Same with the long head of the bicep. It actually attaches to the glenoid and the radial tuberosity. It is responsible for glenohumeral flexion. So we want to put that thing into extension. So we're going to lay back on a incline. Now, something I want to address in this is don't lay back all the. It's only a slight incline because most of your athletes probably don't have more than 30 degrees of extension. And if I'm telling my athlete to lay back more than that 30 degrees, I'm probably going to get some anterior glide because I don't have that extension. And my body's great at compensating in short term. It might not be for the good of the long-term health, but short term, your body's going to wait again. And you're going to get that anterior glide, which is not what we want. So that's not a huge. Now, achieving range of motion, extremely complicated and messy. And what I mean by that, we talked about the complexity of it, but messy. Approximately 70% of overhead athletes, have shown to have a labral tear. Most of it is an adaptation to throwing, but the reason I want to mention this is when we're doing all these movements, if I have closing angle pain, which means, say, if I'm flexing overhead, if I've got pain on the superior side, the top side right here, I'm going to stay out of that range of motion. I've got something wrong there. So I'm going to try and figure out that closing angle pain. And now when we talk about full range of motion, it's individual to sports and to athletes and to body parts and to movement. And I know you're saying, like, Coach, thanks for helping me out. That's a lot of shit. Sorry for cussing. It's individual to the sport. It's easier than you think. Let's take baseball and let's take football. Most football players do not need the same external rotation capabilities that baseball pitchers have because they have to lay back when they throw. They have to lay back in the external rotation so far when they throw. Your own lineman doesn't need to lay back that far. Still needs external rotation capabilities, but he doesn't need it like a baseball player. It depends on the body part as well, and it also depends on the movements you want to train. Yeah, like I said, O linemen don't go overhead that much, but if I'm an Olympic, if I got a lot of Olympic movements in my program, and I'm a snatcher and I'm a jerker, and I can't get to full flexion, I've got to train flexion to 180 degrees. So it really just depends on what movements are important to your program, what athletes that you're talking about, and then what body or the osteokinematics of that body part that we're trying to work. So just for the overhead people in here, if you're a coach, we're not going to be symmetrical in terms of my right side of the shoulder is going to lay back to probably around 140 degrees of external rotation. I'm probably not going to get to that on my non-throwing shoulder because I'm laying back here so much. I'm just because of my sport, I'm going to have a lot more external rotation, right? But inside of my throwing shoulder, I'm going to have less internal rotation than I'm going to have on my non-throwing shoulder. So as long as those measurements on each shoulder add up to approximately 80 degrees and they're somewhat symmetrical, give or take 5 to 10 degrees, we're good to go. Okay. Moving on, a quote that I liked, just listening to Dr. Andrea Spina talk is, you can't move where you can't move. And so just because they're a jerk and they can jerk doesn't mean they're moving correctly where they're supposed to be moving correctly, because they can't move there. They don't have that motion. They can't actively get there. So, we've got to take that into consideration. When we talk about mobility, right, this big word that's been thrown around, we've got to talk internal first. We can't expect to get to full flexion and say, oh, your lat's tight, when I haven't looked internal, right? And what I mean by that is the capsular space. Do I have enough capsular space, which is a prerequisite for all these osteokinematics like flexion and stuff? Do I have enough space to be able to work into that movement, right? If I have enough space in that capsule, I can freely articulate, my bones can freely articulate around each other, right? Whereas if I don't, I'm against it, right? So I've got to have enough space to be able to work. So that's one of my prerequisites, right? So capsule is the first place we start. And when we talk about that, that's why internal rotation is important at the shoulder when we assess, okay, do you can shoulder? And each joint's different. The hip is internal rotation. The spine is, flexion. So it's different depending on what joint you're trying to work, okay? But the capsule is this dense tissue that encompasses any synovial joint. And so if there's no room to move on the inside, I'm not going to move on the outside, right? And so how do I achieve more space? Well, simply stretching internal rotation is going to help that, like the sleeper stretch, distractions, manual therapy, and then a lot of FRC principles. Like I very much enjoyed going to that seminar and got a lot out of it. Again, I recommend that you do the same if this is going to be important to you. But making sure that we create some space in there. And when I use FRC and I try to create space, I'm talking about pails and rails. And that's the way I'm going to create space, or going to create more range of motion through pails with that. Once I've given myself enough room, I'm probably going to see a lot of these mobility restrictions. I'm probably going to see a bigger increase in flexion, all these osteokinematics that we're talking about. I'm probably going to see a big once I just fix the capsule, right? So once I fix the capsule, it depends on what movements are important to you. Again, if I've got a pitcher and he's at 140 external rotation, I'm probably not going to work more range of motion than that. I'm probably work more active range of motion. So he's probably at 140, but I guarantee he's not 140 active. That's going to be passive. And so, that's probably not something I'm going to work on. I might work on another deficiency, right? The same principles apply when I fix my capsule. If I want to work on flexion, right? The same principles apply when I'm stretching, right? I want to stretch that. Just realize when you stretch, your muscle's not actually getting longer. Like I'm not stretching I bands and A bands, right? I'm down regulating that muscle in my nervous system to allow that muscle to reach its full range of motion. And so what I want to talk about here is PNF and long hold. These, and when I mean long hold, it's approximately 2 minutes, right? These are going to stimulate what's called sarcomerogenesis. I'm actually going to add sarcomeres, which is actually going to make my muscle. So just stretching for 25 seconds, AIS stretching, that's not going to make my muscle longer. It's going to down regulate and let me get to a range of motion that I already have, right? But these PNF stretching, that's going to stimulate actual changes in the tissue, right? So don't get me wrong, I use AIS stretching all the time. With my Olympic movements, I AIS stretch my hip flexor to make sure that I'm not getting antagonist inhibition in my glutes, because my extensors, that's what's important on a clean on my pull, right? So don't get me wrong, there's a place for AIS stretching. I don't want to say that, but if we're looking to change tissue, right? The AIS stretching or short-term stretching or whatever it is not going to do the trick. I've got a long hold. I've got to stimulate that sarcomerogenesis. Manual therapy is going to help me achieve a range of motion, just because force is the language of cells. It's going to help me down regulate that muscle. But again, this is where FRC comes in. It's extremely important to me. That's where I use my pails and rails. That's where I stimulate that sarcomerogenesis. I'm actually getting longer and I'm reaching a new range of motion. Training through a full range of motion. I don't think I've met a strength coach that says training through a full range of motion is stupid, but people still don't do it because they can't, right? They compensate. So they don't move through the full range of motion. They find a way outside of that joint and another body part to compensate to make it look like they've achieved full range of motion. So to train full motion, I know it seems kind of stupid to say, but the range of motion is required first, right? So making sure that we're getting that. So modify, guys. And I'm not the guy that says no overhead lifting. Like you can't do that. You don't have overhead, you don't have full flexion. I'm not one of those guys. I don't like those guys. But to me, it's the same as using a slant board. If I see my athletes doing a front squat, he doesn't have enough range of motion at his ankles. I'm not going to say continue to do a front squat. I'm saying I'm going to put a slant board under him. We're gonna hit good angles and good positions on that range of motion. And then once I feel like he's got the range of motion required, then I'll do it. So if I'm seeing a person you know, that can't get a full overhead motion. I'm not going to catch a snatch. I'm not going to do a standing overhead press. I'm going to put them slightly to just make sure we preserve that subacromial space. And then I'm not getting that anterior glute because I'm forcing flexion, and that's how my body is going to compensate. So I'm not forcing arthrokinematics, right? So just keep that in mind. Now, the way, you know, I'm not having seniors digress and stuff like that because, you know, of my planning, right? I'm going to make sure when my freshmen come in and I'm doing, you know, whatever you call, I've been places where it's called the LEAP program, whatever it is, when your freshmen come in during the summer, right? That's got to be something. These movements are important. It's important to get full flexion. That's what I'm going to work on with these guys while I teach them how to pull, and I'm not catching that lift yet. I'm going to teach them, okay, I'm going to teach them the pull, which is extremely complex, right? And extremely technical. And then while I'm doing that, I'm preparing their body to be in a good overhead position. So I'm not saying I'm limiting guys when they, you know, are juniors, sophomores, seniors, whatever it is. So I have a plan about this. Now we've got to work passive to active range of motion. Now, once I've achieved range of motion, I don't have it actively yet. I've got to be able to train into that passive range of motion, because the more passive range of motion that I acquire without, you know, making it usable or becoming active, the more room for error your athlete is, because weakness is in a position is the biggest detriment to health, right? If I'm weak in a position, I get put into a position that I'm weak in, and somebody applies enough force, something's going to go wrong in that position, right? So the way we do that is we both ends. So when your muscle is weakest, shortest, and longest part of the muscle. So my terrible graph here, I know it looks like a kinder, all right, but if you can see, 0 is my shortest, and I'm getting over to my longest here, right? So this, I'm not going to be able to produce. So I'm going to work on the short range of motion, the end range of motion here. I'm going to motion here, and the passive range of motion, because a lot of this is going to be passive right here. A lot of that's going to be passive. All right. So you're always going to regret not training the position you get hurt in. That's played big in my head when I'm thinking all this. So, all right, if I want to talk about this graph a little bit more, if we increase range of motion, so we take the range of motion, say it's here, right, and we move it out here, and then we work on the places I'm weakest, so we work on the long range of motion, right, and we work on the shortest range of motion, this graph's going to change, right? So now, right, my range of motion's increased, my force that I can produce in that shortest and longest range of motion increase, and I get a more desirable kindergartner drawing here, right? And so when we talk about training the passive range of motions, which is going to be right about here and right about here, your long and short, right? You can't concentrically train passive range of motion. That's why it's passive range of motion. You can't get into it, right? So you got to teach your nervous systems about these ranges of motion. And how we do that is isometrics and quasi-isometric, or eccentric quasi-isometrics, or EQIs. And what I mean by that is, right, it's a passive range hold. So I take myself into passive with an external object, or a partner brings me to passive, right? And then I irradiate, and then I try to hold that passive range of motion isometric. Obviously, I'm not going to be able to hold it long, because it's, you know, something I'm not used to. It's going to feel like I'm cramping. I'm going to say, oh crap, right? I'm not used to this. But as the eccentric quasi-isometrics come into play, right, is when I start to fatigue at that passive range of motion, I'm going to drop, arm drop. I'm going to fail with good technique. And that's that eccentric quasi-isometric. And the eccentric play is because that's another stimulant of that sarcomerigenesis that we talked about. So those are two things. Again, you can't concentrically move into passive range of motion. You've got to move yourself there with an external object, and then train your nervous systems and teach them about that range of motion. All right, coach's eye. I can't that's enough. The big thing is making sure that, you know, we're looking at these. Is my athlete compensating because, one, the weight's too high for smaller muscle, have the range of motion. You know, that is extremely important when we're working the shoulder, just because of the type of joint it is. And saying that, throwing exercises in, okay, I got external rotation here. I got some, you know, I got some scat push-ups here. that thing's off the list. So when it comes to the shoulder, how you do things matters a lot more than what you're doing. Right? The more complex I get, the more room for error at the shoulder that I have. So Coach Joey said is, complex or simple when he moves the complex. Same thing here with this. Just making sure that our eye, like we're coaching the head. If we're not, we're doing something wrong. We need to ask our athletes where they feel this, because if I can't see small, I can't see small glide, which is again that head moving on that fossa, right? If the athlete's not feeling it where they should, it's not happening, right? So I need to ask my athlete, hey, do you feel this? Where do you feel this? Are you feeling it in the right spot? Because again, a rotator cuff fatigue, the thing that holds that ball in the socket, equals more glide. So because of that, I'm going to get a lot more quality than I'm going to get quantity, right? And that's my goal is, because a lot of people go to these red bands. I'm talking elite FTS bands, going to these higher bands. I guarantee you, if we took that same athlete and we put him on a lighter band or a lighter weight, and I really focused on arthrokinematics and how that athlete, I'm gonna get him burning where he should have felt that. So specific considerations for these movements. So external rotation from an abducted standpoint, or the elbow by your side. Easy to compensate. There's a lot of movements your athletes can do to make it look like they're getting this accomplished extension. Again, if I externally rotate and my elbow moves back and I'm getting extension, look at the elbow. Or if I'm abducting here, look at the elbow. If I'm getting anterior glide and I'm going here, right? So a lot of things to watch at. Now, we put the towel below between the elbow and side. This isn't just as a coaching cue, like, hey, don't drop the towel. That's a good cue. Like it's good for our athletes, but that towel gets me to about 30-degree angle, right? And that allows for better activation of those external rotators. So just put a towel in between their arm, whether I'm sideline or I'm standing or whatever. It's a good, external cue for these athletes, but it's also going to allow me to better activate my rotator cuff, right? My external rotators. And you should feel this on the posterior, your backside of your shoulder. You should feel this where those rotator cuff muscles are. External rotation from an abducted. This is easier to compensate than the adducted. I would say start with a support. In front where you're sitting down and your elbow's on top of your knee. You can use a barbell. I would start, and when we're cueing our athletes, I always tell my athletes, there's a steel pipe running through your elbow into your shoulder. So there's no movement there, right? So you can rotate on that steel pipe, but you're not moving forward, back, up, down, right? And then external rotation stretch, right? When we talk about full range of motion, right? So we want to hit full range of motion, right? But when I come down into internal rotation, I want to make sure, look for those arthrokinematics. Am I anteriorly tilting? Am I getting some anterior glide here? So things to look for. And I want to work range of motion, both abducted and adducted. That makes the band a poor option for large range of motion work. And the reason why is, right, I'm in external rotation. I'm weakest at my shortest position. Well, the band's strongest at that position. So I'm not going to be able to get in a good position through full range of motion with the band. So that's why I like to use my full range of motion work. I like to use free weights to make sure that I'm not increasing weight where I don't want to. Horizontal pulls. This is one of the most poorly I see, because we're just looking for weight. We're looking to pull that dumbbell or bar up to us. This is another one that we need to work on. Scapular control. So I see poor scapular control. I see people stay in a locked scapular position instead of letting it move freely. I see arms, which is going to lead to that anterior glide. All right, so mechanics that we're going to look for in rows, like rows, cable row, dumbbell row, whatever it is row the weight back, right? I want to see a natural arcing from the side, right? If I pull straight up, I'm probably going to dump that shoulder forward. So I want to go, as my shoulder blade moves, I want to roll that dumbbell or that weight back, right? I should see the elbow move with the shoulder, right? I tell my athletes that think about shoulder blades and your shoulder, your arms are just a byproduct, right? So I'm making sure that I'm not becoming arm dominant. I'm not just really trying to rip that thing up with my bicep, all right? And just like your external rotations, I want to bring my elbow a little bit out to 30 degrees to allow for activation of that rotator cuff. And because of that, it's going to pull my humerus into that fossa, right? And I'm going to get less anterior glide because my rotator cuff's allowed to activate a little bit, right? I shouldn't see a jerking motion, because what happens when people get heavyweight, they jerk and then all of a sudden to a poor scapular position or anterior glide. And again, I should feel this at my upper back, not my arms. If we feel in our arms more than our back, we have a problem, right? Horizontal pushes, it depends on whether I categorize them in a reaching or a pressing exercise. And what I mean by that is my scapula locked down or is it free moving, right? These exercises, just make sure you got good shoulder blade movement. This could be a landmine press, right? This could be head pressing, right? If I'm overhead pressing, I got full flexion, I'm going to see some good shoulder blade movement because it has to rotate up to achieve the position I want to look into, or I want to get into, right? The weight should not force into thoracic, lumbar, or cervical extension. Again, the point of this when I reach is to get good upward rotation, right? If I'm extended at the cervical spine, that levator's toned up, right? Extending at the lumbar spine, when I'm putting stress on my lumbar spine, which is universal, like, right? But it's also toning up my lat because it articulates down to my lower back. And then my thoracic, right? I shouldn't extend there. I should have a natural spine so my shoulder blade has a good surface to glide upon. And then pressing exercises like bench press, we need to make sure that we have extension first, right? Because I need extension to be able to bring that chest, that bar all the way to my chest, right? And so if I don't have extension, how's my body going to compensate for that? Can max here, right? I'm gonna glide forward, and a lot of your athletes will say, "I'm like, I got some pain at the front of my shoulder." If you took that person back and asked them to get actively into extension, he probably doesn't have the amount of extension needed to bring that bar down to his chest, right? The scapula is set up at the tilt here, right? I've got slight spinal extension, and boys are packed down and back. And the reason for that is, right, we talk about our lat, we talk about I needed to tone down movement, but I needed to tone up for these pressing movements like a bench press, because it's a stabilizer, right? It's a downward rotator attached to my humerus, a huge stabilizer. So at my spine allows these lats to turn on a little bit more. And then just like I talked about with horizontal pulls that forward, again, just to make sure I've got good shoulder osteoconnected. Specific considerations for vertical pull. The biggest thing I don't see is full range of motion. The reason we want that, the scapula is starting to be pulled into upward rotation. So we want to train that upward rotation, and we can do that eccentrically, right? Into flexion. We can eccentrically train it into upward rotation. And what are we doing? We're stimulating neurogenesis. We're increasing length of that muscle, right? And so we're getting the things that we want out of it. So just make sure that we're training through full range of motion. If you have an athlete that can't do it, put a band on them, whatever it means that you want to do, get them on a lat pull down machine. I don't know how you want to modify that. Make sure you're hitting full range of motion, and then on the way up as well, making sure I get my hands by my collarbone, and I'm not doing this, right? Again, I have to be able to get to full 180 degrees of flexion. If I'm going to standing over where there's no decline at all, I'm straight up and down, I'm full vertical, right? Again, I need capsular space, I need flexion capabilities, I need to have a serratus activate. My lower trap has to be able to activate, and I have to have the ability to tone down downward rotators. So considerations, once all this is accomplished, make sure we're not spinal extension, right? So making sure that, my lower back, arching, because that tones up my lats, and, I want to be able to rotate, my cervical spine. I'm not toning up my levators. Considerations that we've already talked about that I want to remind you about. So specific considerations for some important muscles that we're talking about, which is, making sure our scap is able to move well, right? Serratus anterior. Before I do any serratus anterior work, I make sure I get some manual therapy on my antagonists just to make sure that I down regulate them. So roll out my lats, my levator, and I've used kettlebells on the pec minor, or sorry, the rhomboid and the lats, or however you want to do that. But I like to tone down those just to make sure that I'm getting as much out of my serratus. Again, you've got to feel it. It attaches to those ribs, so the way I talk about it, right below my armpit is where I should feel it, and my athletes how they're feeling it, and that lets me know, right? Start ground based up that help them feel that movement and help them turn it on. I've got to get above 90 degrees of flexion, because once above 90 degrees of flexion, then I'm requiring my serratus to turn on to allow me to get above 90 degrees of flexion. So even when I'm doing a scat push-up down, just flat scat push-up, I'm gonna get my hands out in front of my shoulders to get that, right? Again, I'm gonna limit cervical extension, down regulate the levator. I'm gonna limit my anterior pelvic tilt to make sure I'm not toning up my lats. I'm gonna create a flex T-spine. Again, I'm gonna ask them to round that back, so I give them the scapula a good surface to rotate around. So anytime I do serratus work, I tell them I want to round it back. I want you to get hunchback on me, all right? And I get it. We're not gonna look like a hunchback on an overhead press. I get that, but I'm trying to turn these on as much as I can, right? And then I can get unilateral and drive a little bit of rotation. So I'm on the wall side and I do a unilateral and I drive that rotation. I'm going to get that rotating up a little bit harder too. My low trap, again, manual therapy on my inside. A lot of kettlebells on this, so just having them lay on their back. They can do it with a barbell. Like you can find a way, get creative to start to get some manual recliners, so it's a lot easier for my low trap to turn on. Again, this is easy to compensate with your T-spine, right? So we shouldn't have a big chest cue here, right? And I want to reach and lift, right? My scapula is going to rotate up slightly, right? And then I'm going to lift, right? And I want those fibers, if you can see in this picture right here, run at about 135-degree angle from my spine. That's what my arm's at. So that's why we do Ys, is to run with that same fiber location as we see in this muscle right here. My progression for my serratus anterior, again, I start on the ground. A lot of this, I got a lot of Eric Cressy videos. Again, I learned from smarter people. You can go and watch his videos on these and these all fours belly lift. Again, making sure my front of my shoulder with the alternating lift off, I'm getting that rotation, right? I'm getting a little bit more activation of that serratus. Scat push-ups. Remember that we want to make sure that we walk our hands in front of us a little bit. Right? And then push-ups is basically where I do a push-up into a pike, where I throw my butt back, I push the ground forward, and get some rotation there. FOB just means on a bench, foot on bench. I in my programming. Bear crawling, especially reverse bear crawling, because I have that ground forward and up, right? And when I bear crawl, I should be the whole time I'm doing a bear crawl. I want to be protracted with my scapula to make sure I got good stabilization, right? And I want my butt a little bit above my shoulders. Again, let's be above 90 degrees of flexion, right? Wall slides with a roller. As you can see, I get down and I get up a little bit more, and then I get into more complex movements as I progress, right? So how do I apply these principles? The team I'm coaching, what period of the off season, and basically your head coach. Like I'm a head coach, I train softball as well as football. I've got an awesome softball head coach. He reads a lot into strength and conditioning literature. So I personally like block for softball, not because they run long distances. I obviously know that from a recovery standpoint. And Cal Dietz has a really good lecture on this if you're looking to that, as triphasic aerobic block. But during that's my first 2 weeks of my cycle. My prerequisites needed, right? Obviously aerobic capacity, it's an aerobic block. I'm in range of motion because, I'm not doing an hour and a half of aerobic stuff. That leaves a lot open for me, right? I'm expanding range of motion, whether it's the capsule, external, whatever I need. Extension for my softball pitchers, they're coming back here. So I work extension with softball pitchers a lot. I work on being able to scapulate, upward rotate, and posterior tilt, and teach them those movements and foot strength. So that's just a basic overview of stuff I work on in that first 2 weeks with softball. Now, football, aerobic block, no. I just come in and like, why aren't we moving freaking weight? So it just depends on your sport coach, what sport your is. Where I do this, I obviously expanding range of motion where I need to early off season, and then as I progress, I start working those passive range of motions with strength, isometrics, EQIs, right? And so, but a lot of the expanding of range of motion is done when they first get here. My LEAP program, my freshmen, I expand that range of motion, and I use CARS, or controlled articular rotation, which is another principle inside the FRC, to make sure that I maintain that range of motion. Because you have mechanoreceptors all along your shoulder that with your brain, how your shoulder is moving. It's for any joint. And that's why if we don't use it, we kind of lose it. Saying is I start to lose those mechanoreceptors, right? So with the football team, principles to maintain motion I use from the FRC, the CARS I use to maintain. I've done this. I made the mistake. Don't YouTube CARS or Pails and Rails and throw them in. I highly recommend you go to the FRC course and learn exactly what these are, the nuances inside of them, and that'll give you a way better idea to program these inside your program. I use the CARS as a warm-up and during lifts as complex work. They don't fatigue the actual system too much. So I use them as a warm up, and I use them to get ready for some shoulder work as a complex before that actual exercise, right? Pails I use to expand range of motion. I use these on non-lift days. So extra work to do, saddle up Saturdays is what we call, Saturday voluntary work, saddle up, right? And then we also give them homework too. And so we understand that some people might not be in a position to give them homework. You don't trust your guys to be able to do it. Obviously, it's an individual based on you give them homework or not. But once we started doing CARS regularly, our guys started feeling really good and started realizing, how much better that these principles at FRC are making them do. And so they start to invest in it. And obviously, how coaching is going to tell your athletes if they should be invested in it or not. If I'm not coaching it hard, they obviously important to me, and it's not going to be important to them, right? So when I strengthen, if it's in a complex, it's never paired with an upper body movement, because I'm a complex pair cleans with a hip flexor release or AIS stretching or whatever. So I pair exercises, right? I never pair it with an upper body movement, just because I don't want to fatigue the rotator cuff or whatever it is. I don't want to fatigue that right before I have to do a complex movement that requires that. So just keep that in mind. I make release my antagonist during the warm up or the lift. My passive range of motion training, my PRHs, my passive range lift offs. I'll train that once or twice per week. It ends like PRHs, passive range holds, where somebody takes me into a hold, or I use an object to take me into the passive range and I hold it. I can do that on, because sometimes it requires a partner. So that's part of my non-lift days a lot of time. PRLOs, lift offs, it doesn't require a partner. And so I can do it inside. Again, this is taxing stuff. Like if you're doing Pails and Rails, you're doing PRHs, you're doing PRLOs, it's extremely taxing. So again, this is never even close to the front end of my workout, right? Or session. It's always going to be on the back end to make sure I'm not fatiguing something that I really need for an important main. And then full range of motion training, right, is where I work through a full range of motion. Again, my rotator, I'm working eccentrically, I'm working concentrically. I'll put that inside my workout of flex. And if I don't have it in workout on a specific day, it'll probably be somewhere in my warm up, just to get it activated, just to get blood flowing to it, just to turn it on a little bit, right? Rather than fatigue it. My serratus anteriors, I do movements for the serratus anterior before overhead movement, that scapula, getting rotation up. And the same thing I do it for the low trap as well. So how I plan where these exercises go, this is just an example. Use any progressions in this. I just plugged in exercises, right? So there's days I want to fatigue it, right? I really want to train the serratus. Other days, like I'll do overhead day, right? If I'm not fatiguing that on a day, it's going to be my warm up to activate it. So right, Monday or day one is a non-overhead day. I'm going to ball slides towards the end of my training. So I'm going to actually get some more sets in rather than just maybe a set of 8 or, something to turn it on. Right. And then every other day, especially on my overhead days, right, I'm going to get it in my warm up to get that serratus. So get blood flow to it to make sure I'm turning it on. Right. I'm going to get that work. And when I do this, I also keep in mind important movements of that day inside the warm up, like, okay, I've got a bench day. Well, I'm going to do some adducted, sideline external rotations in my warm up just to make sure my stabilizers are ready to go for that heavy bench press, right? Because it's the whole humerus in that glenoid fossa. So, my bench day, I'm in my warm up, I'm getting sideline external rotations, right? And so I'll have one day for each of these where I'm fatiguing it, right? I'm actually training it. And then the other days I'll have as a, warm up, get it going a little bit, get some blood flow there. All right. And again, these aren't micro progressions. These are just random things thrown in there. So if you have any questions, I don't know if I went over in time, to be honest with you. I'm on. I'm not sure if I went over in time, if I have availability to do any questions and answers. But if you do have questions, I'm more than willing to answer them. Use my email, Twitter, Instagram.
No, absolutely. You have a couple questions. You're doing fine. So I'll just jump straight into it. The first question we have up is from Zach. He's asking if you've ever run into a lifelong overhead athlete who may have developed some structural changes to their glenohumeral joint, and they weren't able to reach range of motion goals that you set out at the initial onset.
I wish that question was a little bit more specific in terms of what he's actually talking about. But let's just say rotation. I had a softball athlete that came in and she shot the ball. Got no external rotation. She didn't have external rotation because she never worked on it. So she had a lot of issues with her elbow. And so, really, unless you have a labral tear, something structurally wrong, you should be able to get them into the range of motions that you desire if you're making sure that you're using effective means. Again, short-term stretching 40 minutes to do it, because you don't lengthen the muscle. Your A bands and your I bands and your sarcomere don't pull apart and stretch, right? You just tone down that muscle. And so in order to actually build length, you create sarcomerogenesis through long holds of 2 minutes or more, through eccentrics. Again, I would look into FRC, and I think Halo Rails could really help that athlete. Again, if you have closing angle pain, right? I'm coming here and I have pain in the back of my shoulder or whatever it is, you probably need to get that checked out because you might have something going on. But unless they have a labral tear or some bony anatomy that's preventing it, they should be able to get to those range of motions that they want. Again, I could answer a little bit more specifically if they gave me more information. But
that was good stuff. Moving on. So Elijah asked, is poor internal and external rotation a determinant of poor thoracic mobility?
No. I think it goes the other way. I think, if I've got poor thoracic mobility, realize you're not going to get a lot of thoracic mobility because what's attached to this, right? And ribs connect at the front. So, there's not this huge range of motion that can acquire at the thoracic spine. Now, yes, we need it to move, right? But when you see huge ranges of motion in the thoracic spine, you're going to see it more at the thoracolumbar joint, right? Where the thoracic spine meets the lumbar. That's where you're going to see it. What I'm going to do is I'm going to make sure that, I do some manual work on, my flexors in my spine, some deep muscles in my spine. I'm going to do some manual work. Tail rails works on the spine too. And so I don't think external rotation, internal rotation have an effect on the thoracic spine. No.
Cool. Next question is coming from Matt. He's asking, so is the need focused on eccentric training in regard to shorter range of motion? And then do you focus more on compound movements? And he kind of clarifies and specifies, wouldn't those compound movements still activate the fibers and improve range of motion?
I mean, it depends. Like, rotator cuff's always turned on. Like, there's a myth out there where, like, if you go over 5 pound head, you're not turning on your rotator cuff, your shoulder would dislocate. You know what I'm saying? If my rotator cuff is holds my humerus into my glenoid, I'm going to dislocate that if my rotator cuff's not turned on during these complex movements. So if I'm doing eccentrics, I'm going to get some eccentric qualities out of that in my rotator cuff, even if I'm doing eccentric. I do eccentric. I really like a lot of the stuff that Cal Dietz puts out, and I use them in a full range of motion because that's what I really want. I want to work eccentrics at the short and long range of motion. So when I do, I'll do eccentric chin ups. I do it for bench press as well. I do it for basically everything, even external rotation. And so I do it for everything. But obviously you're going to get a lot more bang out of your buck for complex movements as well.
Good stuff. So asking Sean's here, question he had was, what are some of the key differences you see between some of your throwing athletes? Because you mentioned having coached softball, some of the differences you've seen between softball and baseball and their shoulders.
And the shoulders, well, a lot of it is difference in pitches. My position players, they're still, the mechanics should remain very similar. I mean, you have your ball, but the mechanics should remain very similar. Whereas pitchers in baseball have a lot more demand on external rotation than a softball pitcher was, just because of their windup, right? And so for my pitchers, I focus a lot in softball. I focus a lot more on extension because they have to get behind their body. I focus on a lot of extension. I focus on horizontal abduction because, I have to get here to be able to throw the ball. Right. And so, I focus on a lot of that with my soft pitchers, and we work a lot of external rotation, passive range control. I want to make sure that, they can control those huge range of motions that they're laying back to with a baseball pitcher. So, external rotation, passive range holds are critical to keeping a lot of those guys' shoulders and elbows healthy. And it's just making sure that I don't have a huge amount of passive and a small amount of active at range of motion. So those are the big differences that I see mainly between baseball and softball.
That's good stuff. Last one, I had you mentioned a couple times some of the different things you look for with protraction. At the beginning and the end. My question specifically is about some in football. Some of those guys that we see have a serious posterior pelvic tilt. They tend to be bound up in their T-spine and around their shoulder. What are some of the best exercises, or at least like ways you can progress them to kind of relax? Is it a problem with their trap activation, or is it just the entire posterior chain around the shoulder that I really need to be focusing on?
If you're are you saying you're having a problem with them getting to upward rotation, or are you saying like posturally, like are they anteriorly tilted?
Yeah, they both tend to be anteriorly tilted in their pelvis as well as in around their posterior chain around their shoulder. So some of their scaps, they tend to be really locked up. They always get their chest bowed out as well. Okay. Just looking for some ways to kind of gear them towards relaxing a little bit and having a little bit better posture.
Absolutely. If they're anteriorly tilted, you want to do some manual release on that pec minor and really try to hammer that low traction trap home again, you've got to be really careful with the arthrokinematics of that low trap work, and make sure you're progressing. It's a, that, because that low trap could be very weak in some of these athletes. And so making sure I do that, making sure that I'm able to tone down that lat. And there's a lot of really good exercises that really include breathing, because breathing can be an extremely important thing in toning down those lats. And so Eric Cressy has a lot of great stuff, like a TRX squat, where, that TRX point deflection. Obviously, if he's in squatted, he's not going to be too anteriorly tilted, and working on being in that position to get that to tone down. Because obviously the lat articulates down to that lumbar spine. So, I mean, that could be a problem, as well as tight hip flexors can be causing that anterior tilt. So for the pelvis, there's a lot of things we need to look at, core strength, whatever. With the shoulders, again, I just go back to this of just making sure you're hammering home the ability to posteriorly tilt and the ability to upwardly rotate and retract, making sure that the antagonists to those movements aren't the muscles that need to create those movements.
Sounds good. Appreciate it, Coach.
Yeah, absolutely.
I'm going to turn it over right here. I'm just going to roll right into mine.